Many thanks for staying with us. It's still the conversation, and this morning we're focusing on Nigeria's renewed efforts to end polio and protect children from other vaccine-preventable diseases. We'll also be examining government actions, community involvement, and the role of health workers and development partners in sustaining immunity for all. But joining us this morning to have all of these conversations is Folake Kuti, Project Manager, Boost Project Save the Children International. You're welcome.
Thank you.
We also have Dr. Ayodele Rena. He's a consultant pediatrician.
Thank you very much for having me.
Okay, we have Abiodun Oroja. I hope I got it right, ma. Okay, she's a community-based health champion. You're welcome.
Thank you so much. Good morning.
And last but not the least, we have Dr. Adebayo Adeniji. He's a medical doctor and public health advocate.
Thank you very much.
Oh, why am I looking at him again? Okay, I will be starting with you.
All right.
Other preventable diseases, vaccine-preventable diseases, what are they for those who do not understand and for those who believe it's just about polio? I'd like you to enlighten us on that.
Vaccine-preventable diseases basically are illness diseases that are common within our society that usually cause morbidity and mortality, but are however preventable with the use of vaccine by getting immunized against them. We have various kind of these diseases in our society today, and it's disheartening to see anyone come down with such diseases which are vaccine preventable. Some of these diseases include polio, like you mentioned, the polio virus, which causes acute flaccid paralysis. We also have children coming down with diarrheal diseases that are actually as a result of viral illnesses like the rotaviruses. This, for example, is also vaccine preventable by just getting a vaccine. We have what we call tuberculosis, which everybody knows generally, and this is also a disease that is actually preventable. By just getting vaccines, you are preventable. The disease is entirely preventable for life, and you are not going to come down with that disease once you are vaccinated with the vaccines. We have other diseases also, like the diphtheria, we have measles, we have yellow fever. These diseases are common within the society. However, because people are not immunized, people are not getting the vaccines, they come down with this disease and end up with different sequelae like death, mental retardation, illnesses. You see a lot of children that will come down with weakness of the limb, finding it difficult to walk and move around. These are some of the sequelae that arise as a result of diseases that can actually be prevented in our society by just getting vaccine.
Just simple vaccine
at our primary healthcare centers and in all government facilities.
Is it just
in the
for
country.
Newborns or adults too can get?
Vaccine preventable diseases basically is for everybody.
Oh, okay.
Although we have specific vaccines that we expect that at certain ages you should have gotten that vaccine. For example, the last outbreak we have worldwide, which is COVID, currently everybody took the vaccine so as to reduce the burden of the disease in our society. We've had adults, a lot of adults traveling to some countries. They will tell you to get your yellow fever vaccine because they don't want you to bring yellow fever into their country. It's basically a disease that is vaccine preventable. We have adults currently in our time that are coming down with tuberculosis, even though it has a lot of risk factors for it. However, coming down with tuberculosis, for example, is also a disease that could easily be prevented by just taking the BCG vaccine. So once you take that vaccine, you know you are protected, your immune is heightened and able to resist any form of the tuberculosis bacilli that you might be exposed to later in life. Our children also, they get the oral polio virus, which helps prevent the polio. It helps prevent the acute flaccid paralysis that renders them unable to walk and move around with their peers. But once they get these vaccines and complete their dose, they are protected for life against these diseases.
Okay, you've talked about children, but I want to direct it to the pediatrician now. Okay, Dr. Rena, I want us to talk about the vaccinations,
Yes.
for children right from birth until about the age of 10, because my daughter got into uni recently and he told her, oh, you did not complete your
Your vaccination.
your vaccination. And I said, oh, I did. He said, no, there was one she could have collected at the age of 10 or 9,
Yes,
9, which
9.
I don't know.
Human
I think it was. I don't think that was.
HPV.
I think that was more of ignorance on my part. I had to apologize to her. So I'd like you to talk about all these vaccinations for children at birth.
That's great. So, I mean, Dr. Jeniji has done a great job, giving us a preamble into what exactly vaccine-preventable diseases are and how these vaccinations work to prevent these diseases from affecting our children. Now, the idea is that the more people are vaccinated, the fewer people will get those diseases. We call it herd immunity, such that if I've been vaccinated or if I've been unvaccinated, the likelihood that I'll come across somebody that is not immune to the disease is very low, because a lot of people have been vaccinated. And these diseases are highly communicable, meaning that they can transfer very easily from one person to the other, either through the water supply or through coughing, sneezing, and so they are transmitted really easily. So the more of us are vaccinated, the less likely it is that people will come down with these illnesses. That being said, the idea of the routine immunization, which is what we give, children up until the age of 10, thereabouts, is that before children are exposed to these illnesses, that they already have protection. Meaning that we actually offer vaccines for about 16 vaccine-preventable diseases, as Dr. Jeniji has mentioned, including tetanus, diphtheria, whooping cough, some strains of meningitis. And the routine immunization schedule right now, we start at birth. Of course, I can't give you the entire list, but just to summarize, we start at birth, 6 weeks, 10 weeks, 14 weeks. Then we also do at 6 months some supplemental things like vitamin A. And then at 9 months, we give measles and yellow fever. And then we see the children every 6 months until they are 5 years, giving them vitamin A. But the latest introduction actually is the human papillomavirus vaccine, which was actually launched in around 2023 thereabouts, but now has been added into the routine vaccination schedule to prevent our girl children from getting cervical cancer later in life, because we know that it's the human papillomavirus that is responsible for cervical cancer, and by protecting them from that, we protect them from getting cervical cancer later in life. And in January, by God's grace, as Energy might mention, we'll be rolling out the MR, which is the measles and rubella. And rubella is, of course, we know measles, that it affects the skin, but can also affect the lungs and the brain. But with rubella actually is very dangerous in the sense that a child who has rubella might not be so ill, but if a child that has rubella comes in contact with a pregnant woman, it can actually, and the pregnant woman catches that rubella from that child, the unborn baby might actually have problems with their brain, with their heart, with their vision, and with their hearing. So it is protecting even the unborn generations if we're actually vaccinating our children against rubella. And so that, in a nutshell, is why routine vaccines for children is so important and why it must be bolstered and it must be, promoted actively.
Oh, quite insightful there, Dr. Rena. The next question is for Oroja. As a health advocate, what are your realities or challenges you face in bringing people together in communities and, of course, educating them about these vaccines?
Thank you so much, Mama Peter. You see, within the community, there are different types of people in there. When you go to some people, they welcome you warmly. They thank you for coming to their house or coming to their church, mosque, etc., etc. But when you see some people, they tell you, especially some set of people in this country, when you get to them, they will tell you frankly that without their husband asking them to bring out their children for vaccine, they will not bring them. So what we used to do now is we go to their leaders, ask their leaders to talk to the husband. Husband now asks the wife to bring out their children. It has not been so easy. It has not been so easy, especially during the time of HPV, cervical cancer. It was a serious job for the mobilizers, for the traditional rulers to even go out. They went out with us, talking to people, telling them. They said, the government want to reduce the population of the country. And we were telling them it's not true. It is not true. How can a government who owns us wanted to reduce us? But the Holy Scripture says, my people, they
Perish from lack of.
From
because
lack
of knowledge.
But that is where you come in.
That is where we come in.
That is where
and
you come in.
we continue to sensitize them, talk to them, beg them, appeal to them that vaccination is one of the best things they have to take.
So over the years when you started this advocacy until now, have you seen any progress in people?
A lot of progress. Lots and lots. They are changing. We will get there. One day we are getting there.
We will get
there.
there.
Are lots of changes. Initially, you see, before I go on, I want to thank the Lagos State government and our partners who has been trooping into Lagos State to work with us. They make things so easy for us, like Save the Children, UNICEF, WHO, etc. So many of them like that. We go out, most of the time, we go out to sensitize people. They make vans available for us. They make funds available for us. They make this work much more easier. Primary Health Care Board, they are all, everybody is on deck. And I know things are getting better. It is getting better day by day. And one day we will get there.
Okay, we will get there. Now, Folake Kuti.
Yes.
Okay, you are project manager, Boost Project, Save the Children. She mentioned your project just now.
Yes.
So I want you to tell us what you are doing, or what your project is really doing in ending polio.
Okay, thank you very much, and thank you, Mrs. Oroja, for that mention of Save the Children. So Save the Children, as an organization, we are concerned with anything that concerns children's survival, learning,
How
development.
Do you know about it?
So in the area of survival, that's why we work in the health sector. We've been working with Lagos State government for over 12 years now in health sector, education sector. But this Boost project is targeted at eliminating zero dose. Zero dose are those that did not get immunized at all. Children that are never immunized.
So some children are never immunized?
Yes.
But are they not born in the hospital?
So they are not born in the hospital. A lot of children, we have studies that have shown that a lot of children are still being born in traditional birth attendant homes.
TBAs,
Some are born in faith homes like churches that have maternity homes and the rest, and there are very many. So we have children, or some you're under immunized are those that maybe they were born even in the hospital, they will get immunized immediately, and then they never went back to complete the vaccine. So, and this project came into Lagos and Kano State. We are working in 2 local government, and we are being supported by GSK. That is a GlaxoSmithKline. And what we've been doing so far, we've worked with, because there were studies that were conducted, and in Lagos State, in Nigeria, there were 100 local government that were identified that they have zero dose and under-immunized children. And in Ikorodu, even though Lagos is the center of excellence, Ikorodu and Alimosho happens to be one of those local government. That's why we are working in those 2 LGAs. What we've been doing since last year, we started by identifying the health workers, frontline routine immunization workers in the primary health care centers, to find out if they actually have enough knowledge of what has been happening. You know, some of them, maybe they left school 10 years, 15 years, and some of the things, because from the study, we also discovered that health workers have a lot of role to play in making people to want to come back, for those that started immunization, to want to come back. So we discovered a lot of things. What we did was to organize trainings for all the routine immunization workers. Then we looked at the tools that they're using to generate data and the rest, and we discovered a lot of things. We did adaptation of the tools, and then we also work with the primary healthcare board, and we are working at the state, at the local government level, to make sure that while they are still doing those immunization, we have people going there to monitor them, to supervise them, and do on-the-job training for them. Because all the attitude in terms of maybe the way they relate with clients, with caregivers that bring children, some of the community people, they say, I know, I will not go back to that health center. We don't want all that to be happening. So those are the areas we are working with the health workers. We are also working at the community level.
Okay.
We have an intervention we call community action cycle, PDQS, where community people will identify all the issues that are coming up when people go to health facility. Health workers also have their own issues that they also have with community, they also have with government. So far we've been able to organize these meetings. They will identify issues and look at ways to solve those problems, either with the government or what the community can do to solve those problems. Like Mrs. Oroja spoke about some of those things. Another thing we are doing, we also discovered that even the Lagos State vaccination law, which is under the child right law, is also overdue. Like we have COVID, we have MR, so many other vaccines that come, they are not even there. So we need a law that can be enforced so that people will actually go out and vaccinate their children. Then in the area of financing, at the local government level, apart from the fact that local governments are getting more money, they are actually supposed to be responsible for immunization support in terms of logistics and the rest, but they have not been forthcoming. So we are engaging with local government chairmen to also see that they start releasing money so that health workers will be happy they are working, the environment will be okay. Then in the area of data, we have discovered a lot of issues. We are also working in that area to make sure that data that is coming from Lagos State is excellent, just like Lagos State is the center of excellence. And other states can actually come and learn from Lagos State. And we want to see that when we finish this project, that the government will take some of the learning, some of the issues, and actually take it to other local governments and implement it. And Lagos State, as it's always been the center that people want to look up to, that Lagos State will be the center of excellence. When we talk about immunization, there will be no zero dose and under immunized in Lagos State. Okay. So those are some of the things we are doing.
Fantastic work that you're doing here. So Dr. Adeniji,
yes, ma'am.
This brings me, from what she has said, do you think government should focus more on campaign or, strengthening the PHCs?
Campaigns are fund intensive.
Okay.
The truth is, to sustain immunization, to get people vaccinated in Lagos State, we really need to strengthen the PHC service and our routine immunization services. That is the only solution. That is the way out.
Now, when you talk about strengthening, what exactly are the needs concerning this vaccine-preventable diseases?
Well, currently, like we have currently in the state, and as not peculiar to only Lagos State, we have some certain wards that do not have primary health care centers. And we also have hard-to-reach areas and riverine areas where it is difficult to get. And you have people staying in those communities. So you need to actually take the services. If you want to get to them, you need to take the services down to those people. Ensure they're having outreach services, create mobile clinics, and also integrate immunization service with other services that will be provided in those specific areas. Getting to those riverine areas, for example, you will be getting logistics, use of boats, and even we've had situations where you will get to the site where you are going to take the boat, you'll be told, oh, there is high tide, you have to hold on till another period. So these are some of the things that the state government currently is actually working upon. The state has been able to also get 2 boats that we'll be using to ferry our healthcare workers, our community healthcare workers, to these areas to ensure that people in those areas are not disenfranchised when it comes to health, and ensure equitable access to healthcare services, and not just for people within the urban areas only. So strengthening our routine immunization is actually the way, because how many campaigns are we going to run to reach to get to all these people? So we need to ensure that routine immunization is strengthened. We ensure that people are informed. We engage the communities. We let them know the essence and the importance of actually getting this vaccine. Make them come into the facility. For those that are unable to come into the facility, we take this service to them, because the Lagos State government currently, our focus is basically to ensure that no child dies or is impaired from a vaccine preventable disease.
Okay, government will do their own part. You will do, health policy makers will do their own part. But it all boils down to people. So, Dr. Rena, how do you handle, hesitancy for vaccines with parents? And what are the major misconceptions, you get to hear about?
Hesitancy is a very important topic when it comes to vaccine delivery, because you cannot forcibly grab a child and begin to jab them. It really does need to come from a place where the parent has willingly agreed that the vaccine is necessary. And hesitancy is a growing problem because of misinformation, disinformation, myths and misconceptions that are being spread like wildfire everywhere on social media. And in these days of social media...
Aside from reducing population.
in these days of social media where everything just moves so quickly. Of course, Mrs. Roger has already spoken about the idea that the population, some people think that somebody somewhere is trying to reduce our population. And how do they achieve that? Through vaccines, because vaccines, are things that are actively promoted and that a lot of people get. And the idea is that they say that there are things in the vaccines that might reduce fertility later in life. But these are unfounded claims. There are a lot of misconceptions. And again, the mistrust and distrust, has come from some experiences of, certain people in the past that maybe they were given certain medications that they had the normal adverse reactions that can happen to with medications. And then they say, oh no, we should stay away from vaccines. But vaccines are safe. They are extremely well tolerated by a majority of people. As a matter of fact, in my almost 15-year career, I've not seen a vaccine reaction that caused a death. I've not seen a serious vaccine reaction, maybe a fever here or there, maybe some, slight discomfort, but no serious effects. But again, there's a lot of fear on the part of parents to say that, what if it causes infertility, or what if it causes a serious adverse reaction? That being said, I think the role really of the healthcare worker, when they come to us and they say, okay, you know what, I'm a bit skeptical about getting this vaccine. The other thing, of course, is autism. I think I should mention that. So right now, there is this movement that is saying that vaccines are responsible for autism. There's no evidence for that. Vaccines are not responsible for autism. We know that autism is mainly a genetic disease. And for those who don't know what autism is, essentially it's a developmental issue of the brain in which the child has communication difficulties with language and they have a certain different way of, behaving. So that being said, we always have to counsel them at every encounter to say that this is a misconception, this is a myth, can we give you the vaccine now? And we cannot stop counseling them at every encounter that we have. Being frontline and front-facing and facing the parents, we have to do this continuously. And then also launch campaigns that are widespread, such that on social media, on traditional media, we are telling people constantly that vaccines are safe, vaccines was. It is because of vaccines that we don't have smallpox anymore, because of vaccines that polio is on its way out. And of course, the theme for World Polio Day today is End Polio Now. And so, so we can do this because vaccines are safe, they work, and they do not cause harm.
Cause any harm. Biodun Oroja, Dr. Adetunji spoke about access, to rural areas, in during advocacy. So, as a health advocate, talking about access, what are the challenges you face, and what do you want from government to help in that area?
Thank you so much. Like Dr. Adeniji has rightly said, we need to be mobile. We need vehicles to work with, megaphones to work with. Like they said, the government is giving us for hardly to reach. In my own local government, which is Alimosho local government, and it is the biggest in Nigeria, we don't have so many hard to reach. But for the people in Ekpe, Ikorodu, all those riverine areas, they need boats to work with. Most of the time, I saw our partners and our health workers going on boats during vaccination, going to these places. Even in Makokodia, they use boats to meet these people over there. We need to do rallies even before we started. It is vehicle that we need. The government to provide us with vehicles. At least each local government can have one or two, so that the mobilizers will work with the health educators. We want some of our health they should take Hausas and the Igbos. They should fix them with the health educators so that language barrier will not be a problem.
Oh.
I can't speak Hausa now, neither can I speak Igbo. So we need these people to come to us and work with us. And in fact, they should be recruiting them as health educators so they know what they are doing, and they will work with mobilizers who live in that community, and we will get there, like I used to say.
Talking about community now, I'd like you to tell us how you work with traditional leaders, community leaders, and of course the religious leaders in advocacy of ending vaccine-preventable diseases.
It's so easy. Thank you so much.
Is it easy?
It's so easy.
With traditional?
The traditional rulers, they are our fathers.
Okay.
And yes, they are our fathers. We don't know it, not until we want to vaccinate that we go to them. We live in the same community. Like Kabiesi Onishasha of Shasha is our patron. We go there often and often with the directorate health educators. We know the religious, the chief imam of Alimosho. We know them. The Khan. We go to the Khan meeting. We go to the mosque. On Fridays, we go there. They see us. We talk to our women. We talk to our fathers there. So it's talking to the traditional rulers, the religious leaders is not something so hard. They embrace us. They love us coming to them, and they really assisted us because on Fridays, like we are having, I think the first week in November now, we're going to have oral polio vaccine. They will start, if we go to them now and we give them our letter, they will start to talk to their people on every Friday before we start. You go to the Khan chairman, we know our Khan chairman, we know everybody, and we mix together. We hold meetings together at the state level and in the local government level. So, not that when we want to start working is when we want to go to them. We know ourselves.
Okay.
People talk to people, people understand.
Okay, what about women and mothers?
Women and mothers. That is where
because
Yaloja
that is the
comes
first.
in.
That is those are the first
That is where
contracts.
the Yaloja comes in.
Okay.
We've been to Yaloja General, Folashade Tinumbojo. We've been to her several times. She will instruct all the Yalojas of all the markets. We have the Yaloja General for each LCDA and each local government. We know them, they know us. Like in my local government, Dickness Ogunlade is the Yaloja General. She calls all other Yalojas to come together, and they will allow people go into the market. In fact, we use almost all the markets as outreaches. And they will give us a store, give us a place, convenient places that we should sit down and immunize these children. They've been good.
Okay, Folake, Nigeria in 2020, achieved the poliovirus-free status, yet CVDPV still appears. What is Save the Children doing to support government?
Well, what I will say is
that we cannot do without this, with all the vaccines and all this project, these things will, especially that polio that has been eradicated, it will still continue to appear.
Well, the position of Lagos State, it's like the Mecca of Nigeria. So, and Lagos State, we were discussing it before we came in, that Lagos State receives, I don't know the average migrants every day. You have states in Nigeria where they bring in people, like even the communities that we're talking about, you have people that are relocating from IDP camps, people that have problems, people that are even banished from their villages. The next place is Lagos State. So when we have situations like that, it's really very difficult to completely eradicate this. But I believe that the primary healthcare board will have they have surveillance in place. They have people that are monitoring all these situations that can report immediately to avoid a situation that it becomes a serious issue. But what we are looking at is Lagos State not even having it at all, because there was a time that Nigeria was declared polio free. That is a situation we want to have and want to maintain. But for Lagos State, I'm not saying it's impossible, but as long as we have this uncontrolled migration, it's very, very difficult. Like Makoko that we're talking about, people are coming through the Atlantic, through the lagoon. They are coming in from Ondo State, from Delta State, from different places. So that is why some of these things, you'll see a resurgence and you'll be wondering where is it coming from. The government is trying, partners are trying, but we continue to sensitize the people, and most importantly, we continue to work with traditional birth attendants to make sure that immediately a child is born, that child is referred to the facilities to go and vaccinate. And let me give the case of a community in Ikorodu that we were told that when this zero dose case came in, there was a zero dose implementation that was done last year. The other community, the Bale just called all and they discovered that they are mostly migrant children that were not vaccinated. And she gave them ultimatum: you are the one destroying, spoiling our community. I give you so date. If all your children are not vaccinated, we will chase you out. You won't believe it, and all of them, they took their children to the health facilities and they were all vaccinated. So that is to show the importance of traditional rulers, religious leaders. I think we need to use them more as champions. Let them be the one that will be speaking out, because they will, community members in particular, especially the less literate people, they will believe traditional rulers, religious leaders, more than will believe politicians or government. So it's very, very important that we actually need to work more at the community level. We need to work more with the traditional rulers, the religious leaders, the iyalojas, to get people to be aware of the importance of vaccines to the health of the child, and that if we continue that some children are vaccinated, some are not vaccinated, even those that are vaccinated are not safe, because a child can come down with maybe polio, even though the child has been vaccinated, and the child may die in the process and be like, you see a lot of children that got measles vaccine, and they'll still have measles when they go to school. So you discover that for everybody to be protected, for all children to be protected, it is a collective responsibility, and we have to continue to work hard.
Yes, we have to continue to work hard. And Dr. Adeniji,
yes, ma'am.
As a health policy maker, don't you think penalties should be brought on people who refuse to allow their children? Because it's not looking like parents are deliberately bringing harm upon their children. Would you think that maybe sometime in the future there should be penalties? Or what do you think the government can do in order to ensure?
Well, currently we actually have the Child Protection Act that is operationalized in Lagos State. However, our economy, our community are still, should I call it, we are not just a political economy. We are religious, we have our customs. So,
what about custom that is saying you shouldn't immunize your child?
No, not really. The truth is, even in as much as vaccination is free in Lagos State and in the country at wide, what was it called? Before you can vaccinate a child, we still ask for the parent consent.
Consent, yes.
So you don't just grab a child on the road and vaccinate.
So in a situation where a parent says no?
So that is the reason why we use our sensitization method, our advocacy method. We try as much as possible to mobilize and make them aware, because it's better to make an informed decision, get to know about the reason why you actually need to vaccinate your child. With that, it is easier to get you to bring your child in by yourself. It's easier for you to be reminded that every 4 weeks, every 6 weeks, in the next 6 months, I need to take my child to the facility to get vaccinated. Implementing a penalty, as good as it might sound, it's not really going to work. And in the sense that if I should get a child today, the mother refused to vaccinate this child, and because of penalty, I'm sanctioning the mother with what? Am I taking the child from the mother?
From the mother.
That is one. Then it means our social welfare services also has to come into place.
Yes.
Also have to come into place. The story is going to be, how many children do you want to collect from us? And if by any reason we institute, give it to any child, irrespective of the parents' consent, if you give it to the child today, are you sure that the mother is not going to take the child and run away to another place? It means the situation, the problem has still not been solved. We currently also have some things in place, like before every child is admitted into schools, into primary schools, they're expected to present their immunization card, because it's basically the government is providing.
In public schools?
Yes.
Oh,
So
okay.
before your child is admitted, you are expected to present with the vaccination card of the child, because you are coming to meet other children, and we don't want your child to also pose a risk to other children within the school. So these are some of the things the government is putting in place to ensure that they are protecting these children, and indirectly ensuring that parents take their children to the health centers or wherever they can get this vaccination done and get them vaccinated.
Thank you very much. It's been an insightful conversation. Every child, regardless of where they live, deserves protection from preventable diseases. These vaccines exist. You've heard from all of them. All of them cannot be lying, Abby. So, parents, do the needful, do what you need to do. I want to thank every one of you for joining us this morning. Dr. Adebayo Adeniji, Folake Kuti, Project Manager, Boost Project, Save the Children International Nigeria, Dr. Ayodele Rena, what do they call?
The noisy.
No, what do they call pediatrician? Abolomo. Abolomo Wewe. And Abiodun Oroja, community-based health champion. And we've been talking about #End Polio and other vaccine-preventable diseases. Once again, I'd like to thank you for joining us. We'll go on a short break now. When we come back, the conversation continues. It's another conversation.